We're in the full swing of our Season 5. Global Health Matters continues to be a credible source as a podcast produced by TDR, a United Nations research program based at the World Health Organization. If you just found us, we have over 70 episodes for you to explore. You don't need to listen to them in sequence. You can look them up and choose a la carte topics and issues that most interest you. I promise you will want to hear them all. Hello and welcome to the Global Health Matters podcast. I'm your host, Garry Aslanyan. In over 70 episodes of this podcast, there is one subject we have never turned to until now. That subject is HIV. For more than 4 decades, HIV has shaped global health like few other epidemics. It has driven extraordinary scientific progress and some of the most powerful activism the world has ever seen. Today, we have better tools than ever, long-acting medicines, effective prevention, and the real prospect of bringing AIDS to an end. And yet funding is being cut, political priorities are shifting, and in many places stigma is not fading but evolving. So as the world prepares to gather for the International AIDS Conference, it feels like the right moment to ask, how far have we come, and what will it take to finish the job? In this episode, we'll look back at where the HIV response began and forward to what it will take to bring the epidemic to an end. I'm joined by 2 guests who have lived this story from different vantage points. Magda Robalo is a public health physician, an infectious disease expert, and president and co-founder of the Institute for Global Health and Development in Guinea-Bissau. She was also Minister of Health of Guinea-Bissau and a director of communicable diseases at the WHO Regional Office for Africa. Joining her is Marina Vergueiro, a Brazilian activist, a filmmaker, and poet, and co-founder of LUSO+, the Lusophone network for people living with HIV. Living with HIV herself since 2012, she has become one of Brazil's most outspoken voices for dignity, mental health, and the rights of people living with HIV. Here is our conversation. Hi, Marina. Hi, Magda. How are you today? Welcome to the show.
Hello.
Hi, Garry.
Thanks, both of you, for finding time to speak about this topic, which it surprises me that in the last 5 years of Global Health Matters, we have actually not had any episode on HIV. And once I was told, did you have any episodes on HIV or on AIDS? And I said, no. So we have come to this episode. So Marina, maybe I can start with you. And I know you feel comfortable talking about it. So you take us back to the moment you actually were first diagnosed with HIV. What do you remember about that time, Marina?
Okay, so thank you very much for the invitation, Garry, and it's really nice meeting you, Magda. So just a little introduction. I am a Brazilian filmmaker and poet that have been living with HIV since 2012, that I know of. And answer your question, I think I'm going to go back in time a little further and take you back to 1992. Mm-hmm. I was about 9 years old, and my biggest fear was AIDS. I didn't have fear of ghosts or monsters. My fear was AIDS. So to give you a picture of, I think that my generation, the millennials, the impact that we had from the HIV/AIDS epidemic. You know, at that time we didn't have 1/10 of the information that we have now, and it was very scary. And And AIDS has always been with me since that moment, It was a subject that I wanted to study, understand, but I was afraid until I got my diagnosis. I was so afraid that I never got tested. I just trusted myself and my partners, like I didn't put myself much in risk. And I blindly trusted my partners as if they had any, sovereignty over my own health, right? And that's the reason I got diagnosed, because of fear. Because of fear, I never did an HIV test, and then I put myself in risk, like 99% of the population. We sometimes put ourselves in risk, and I got infected. But the problem was that I didn't know, because I was so afraid of getting the diagnosis, right? So, I just didn't do a test, even when I thought that I might have contracted it. I just ignored it. And 2 years after I was in this relationship, I started getting really, really sick, really sick. And after months, losing weight, losing hair, and not being able to get out of bed, I finally go to the hospital, and I immediately am, I don't know how to say, interned.
You were hospitalized.
Yeah, I was immediately hospitalized. But during 10 days, Garry and Magda, all the doctors didn't know what I had. They gave me all the medications. You know what? They didn't do the test as well, which is crazy, because somebody my age having that kind of lungs problems, symptoms, it was so obvious to me. So, I mean, now that I know the symptoms, and the doctors didn't test myself, but during one night, one doctor decided to give me some medication, a new one. They haven't tried, and it worked. And it was a medication for a disease that's opportunistic due to HIV infection. And I started getting better. So they tested me, and I was, carrying a lot of virus in my body. And they told me in a way that was not very respectful, I must tell you, very if I had a headache or anything, the doctor itself, but he was accompanied by a nurse. And this nurse was the one that held my hand in the minutes followed, because I really panicked. My family was at the hospital, but they weren't with me because the doctor took them to tell them without my consent. So they violated as well my right. And so it was, how do you say, a lot of mistakes committed both by me and by the medical, the doctors. But fortunately, I have a family that's very, caring and loving, and they did give me a lot of support. And it was not a problem for me that they find out.
Right.
But it's not everybody that has the same, the same vibe on their families, the same opportunity.
And it's very interesting, your experience. You took us back to 1992. Magda, can I take you back to the late 80s? Because I know you were working at a hospital in Lisbon, which is called Egas Moniz, when the first patients with HIV began arriving, or you've been working there at the time. And we just heard from Marina, her experience, but maybe you can also share from the other point when you were working in a hospital. Do you remember the first encounters
I do.
with someone.
I
Yeah.
do remember. Thanks, Gary. I do remember my first encounter with HIV patients. This was in 1989, very early in the year. It is one of those things that when you look back, you think, for some reason, I had to be here. I did my medicine studies in the north of Portugal, in Porto, and eventually applied to do my residency in Lisbon. And this took me to Egas Muniz. Egas Muniz was a hospital dedicated to infectious diseases. So they were receiving patients from Guinea-Bissau who had AIDS. At that time, it wasn't clear whether it was HIV type 2, but these were patients with opportunistic infections, Kaposi sarcoma, long-time diarrheas, very thin because they lost weight, etc. And to me, this was an encounter with fear. There is always a component of fear, just like Marina was talking about, personal fear. Fear, but also an encounter with death all over the world. This new disease was afflicting people, not knowing exactly what it was and where we're going. We had no idea at the time that AIDS was going to grow into the epidemic it became. But to me, going to the infectious disease department every morning to see patients together with my supervisors was a kind of mixed emotions feeling. Later on in my career, from someone who wanted to be a neurosurgeon, I found myself working on HIV/AIDS. I became the head of the AIDS program in my country when I returned home. Before that, I was involved with malaria, but the work on HIV/AIDS in the public health space always stayed with me because of my very first experience as a medical doctor with a new disease that was actually afflicting people from my country.
Well, this is so great that both of you kind of put things into historical perspective. This was really good to do this as a first step, and maybe we can look again at the progress or the experience of countries in the last couple of decades. Marina, maybe if you can take us through in the past decade, what has changed in your experience of living with HIV? You gave us the sense of at the time of diagnosis, but whether or not how this has progressed in the last over 10 years. And how do you see that response in Brazil reflected community and people around you? Marina, can you reflect on that, please?
So Brazil is indeed a pioneer in the AIDS response, and not only a pioneer, but also a country that understood that is a public health matter, and it should be treated as such. We still have a very strong HIV and AIDS program because everybody that is diagnosed in Brazil, no matter if you're Brazilian or not, if you is legal or not in the country, you can have access to the medication. And that's not only the medication for treatment, but the medication to prevent it. So I think that is that's the most important thing. You know, our health system is public and it's universal, and it's very, very important that it stays like this, because you know, HIV/AIDS is a topic and a disease surrounded by prejudice But since I started, living with HIV, since I got my diagnosis back in 2012, I came from 5 pills with one that had to be on the refrigerator. Now I just take one, and that's it. Just one pill. And it's very easy to take, to get it if you live in an urban system. I guess the Brazilian system still have a lot of problems regarding people that live in rural areas, and they do not have access to get the medication. So I feel like this year is going to be a very important year, not only because the International AIDS Conference is going to be here in Rio de Janeiro, but it's also an election year, so it's very important, for the government to, try to maintain itself in place. And so I'm also, and also I think it's very important to highlight that Brazil is one of the few countries in the world, together with Cuba, that has zeroed the vertical transmission from mom to child. So that's a very important fact.
In Latin America, yes.
In Brazil, yeah.
Yeah, both in Latin America.
And it's very important that because, people who live with HIV, who are born with HIV, they are the most affected by mental health issues, right? So also an important thing that I think Brazil is very, upfront in the response for AIDS is that our public health system treats HIV treatment in a perspective of multi-treatment, let me say like this. So it's not only taking antiretroviral drugs, but it's also, checking your mental health.
Like more holistic.
Not holistic, but, taking care of all the things because, HIV affects your brain, so 50% of people living with HIV have depression. And we have, 100 more times chances to die by suicide. So HIV sometimes do not kill us. What kills us is the depression. And that's why we can also have access to mental health care in Brazil. Of course, it has its problems, but most of the countries don't even have public health, let alone treat mental illness together with HIV/AIDS. So I'm very proud of our response, but unfortunately, with the right wing and extremists and conservatives growing everywhere in the world, is not different in Brazil, and they are trying to, make the health public system privatized, and that's something that we cannot allow. And us activists are, doing our best to always, defend the system because it's revolutionary. It's also inspired other countries in the world, like the United Kingdom, the England, for the NHS. Our program is really good. I mean, Garry, I feel like the more we advance on, science and technology for HIV treatment and prevention, the more we go back in time regarding stigma. It's crazy, So, of course, we developed in so many areas, and it's positive, but still, like nowadays in Brazil, we have a very big crisis between 15 years old to 25 years old boys that never use condoms, that have no idea how to protect themselves. So, I mean, what are we doing wrong? Why do we have to keep repeating the same things, like we did when Dr. Magda was treating patients in the 80s? I'm still saying the same things, the same talking points that she was back then. I'm still saying that if you kiss, you don't you don't transmit it. And, it's terrible. And doctors, although they do have access to all this information in med school, they are still very prejudiced. I have a lot of stories from all over the country of women being denied, appropriate care, or even one woman was denied to labor. I don't know how to say, but
labor,
to
yes.
give birth to her daughter because no doctor wanted to touch her because she lived with HIV. Can you believe that? She lost her child, and that's unbearable. That was, in 10, 15 years ago. And it's not something that's very far, it's not something that is exclusive to Brazil or to the global south. It's everywhere. Might not be so much, I don't know, in Europe, but I'm pretty sure in other parts of the world we have the same problems with stigma. And if we don't have the doctors on our side, who are we going to have?
Thanks for that, Marina. So Magda, considering that you've led both national and global levels, you worked, as you said, in Guinea-Bissau. You were actually the Minister of Health in the country. And when you look at HIV response, let's say in West Africa today, and we just heard from Marina how things progressed in Brazil, but if you were to look at West Africa, what feels fundamentally different from, let's say, 10 years ago? What has changed and where are we going?
Garry, it's a mixed bag. There is no doubt that we have made amazing progress in reducing the number of people newly infected. We have been able to reduce deaths from AIDS. We have been able to increase life expectancy, but it looks like we are going back in terms of low barriers, stigma, and rejection overall. We are seeing an increasing number of countries that are putting in place punitive laws for people living with HIV, or not specifically people living with HIV, but people who are key populations and at a very high risk of contracting HIV, facing punitive laws which increase the chances of them being HIV positive. And I think we have left behind children, for example. Children's access to medicines right now is stubbornly low, even though it has increased to about 50%. But we take more care of the adults than we take care of the children. Yet, this is a time in the fight against HIV/AIDS where we could stop transmission from parents to children. So, yes, on a positive note, very good progress in terms of putting people on treatment, in preventing new infections, but we still have a lot of work to do in terms of bringing the new generation to understand where we are coming from. The youth of today does not have memory of what HIV/AIDS was in the 80s and 90s, etc. And they live life in incurring risks of being infected because they don't have the connection with the past that we do. That's a major challenge for prevention, and it's a major challenge for us to bring AIDS to an end. And I'm speaking as a public health person committed to finish the business. We had this dream of ending AIDS by 2030, but at the pace we are going, and of course with other complex issues around the ecosystem, funding, and etc., it is becoming more difficult. Even though technology is on our side, we have better tools now. We can, if we work together and work better, we can conquer AIDS, but somewhat. the work that is left to be done seems to be more difficult for us to conquer AIDS and eliminate it as a public health problem.
Marina, you work closely with other women. You said you have this network as well for countries, Portuguese-speaking countries. And then, obviously, you also have other women you work with encouraging people to test and to take care of themselves. What do you still see how the systems are failing people, those who live with HIV? Not only medically, because you refer to the health system and how strong it is and how sometimes the access is quite high, especially in urban areas, but more about emotional and social kind of support and systems.
I think that we are failing HIV response in regards to the most important factor after, of course, taking the drug is mental health. You know, like we have been having a mental health crisis since the pandemic, and people who live with HIV have mental health problems since they get diagnosed. I can count on my fingers the people that I've met during this whole time that I am HIV positive, which is almost 15 years. I can count on my own, in one hand, the number of people that didn't get depressed after getting diagnosed, you know. And I also can tell you that most of the people that live with HIV still hide, still isolate. You know, I think that we are failing to give people assistance regarding mental health. So I feel that if we don't look for the mental health crisis together, you know, in the same perspective as HIV and AIDS, if we don't put them together, we are not going to go anywhere. Because what makes people, you know, not take the medication is depression or shame or fear. You know, they are all mental health issues. And if we want people to be undetectable, you know, taking the treatment, or if you want to prevent and give them PrEP, they cannot be, you know, suffering from depression. So I that's my take. I feel like we need to start putting AIDS, mental health, in the same
alongside with the actual being infected.
Yes.
I think an important message here, for what we heard, is that we're not only treating the infection. One needs to look at the person who lives with the disease in a much broader mental and other social conditions that they live in. That was great, Marina. Magda, you have seen this, obviously, movement of HIV in your career. There's no way of kind of escaping it. And a lot of that was driven by activism, very powerful, in fact, in terms of putting focus and spotlight on HIV. But today, do you think there is the same level of activism? Or you mentioned key populations in your earlier comment, and whether or not populations are basically being left behind, and maybe particularly women and younger girls are still being disproportionately affected, especially in West Africa. So where are we addressing this, and is the same level of advocacy out there to do that?
Before I answer that question, let me just go back to what Marina said around not just looking at the HIV, AIDS, or a person who's living with the disease, but and then from the strict perspective of that particular infection, but having a people-centered approach to illness or to poor health. This is missing a lot in our health systems, and you can take talk about mental health. You can talk about breast cancer. You can talk about cervical cancer. You can talk about diabetes. As people live longer, they are able to control the disease. They suppress the viral load. They look great. They look good. But they are aging as well, and they are developing other diseases for which the health system is not prepared to address. And you might be saving them from dying of HIV, and then they die of diabetes or they die of cervical cancer. So it is important that really we look into integrating services, and then patients are looked at as human beings in their totality rather than looking at specific disease at a time. Now, coming to your question about activism and how it has not just contributed, but been central to drive the HIV response. If you look at the African continent as a whole, it remains home to the HIV/AIDS epidemic. Majority of cases are on this continent. Majority of cases of new infections are on the African continent. Young girls continue to overstep their male counterparts in terms of acquiring HIV infections. But Southern Africa, and for that matter, South Africa is the leading country if we can talk about leadership in this particular situation, but it's the country with the highest number of people living with HIV/AIDS. So with HIV/AIDS, Southern Africa is the epicenter within the continent. And Southern Africa had drove the activism that's brought medicines from the global north to the global south. You remember the very first treatment for HIV/AIDS were very expensive and were only available in global north and not affordable for patients whose majority were in the global south, particularly in Africa. Activism was instrumental to drive the response, but there is an attention span that can be dedicated to a particular issue. We are talking about over 30 years, nearly 40 years of dealing with HIV/AIDS. In the meantime, many other pressing issues have emerged. Today, we have climate change. Today, we have non-communicable diseases. Today, we have HIV/AIDS coming down in the list of top priority diseases in each particular country. So there is a limit to what activism can do for HIV/AIDS because people are also dying of other diseases.
It's interesting because I've heard the same about malaria, and back in 60s, they wanted to eliminate. And then when it didn't work, they just forgot about it and then came back 30 years later and said, what have we done? It's interesting to look at that parallel. Marina, can I come back to you and just again back to the fact of stigma and whether or not the long-lasting and acting drugs that are being introduced, do you think stigma has changed with these drugs? And is it less or evolved or it's reduced? How do you see things changing on that side?
Well, Garry, I think that stigma does not change because it lacks a lot of public campaigns and less industry lobby. But the reality is that, as Dr. Magda already said, most of the people living with HIV in the world, more than 52%, are women, are Black women. And, a great percentage of that are small girls, from 9 to 15.
Right.
And that are being forced to marry, so they're also being raped. And that happens a lot in the African continent, but it happens a lot in Brazil. Brazil is one of the countries that has the highest rate of child marriage, So I guess that it's a lot of effort that we have to put on to really fight stigma. And I think that we rely only on, a few activists, and we cannot do it ourselves. We need stronger, machines like government, like media, like industry. But it's a very, very difficult job because, there's always people in the government that are prejudiced, and they associated with the gay people and they don't like gay people. So they try to, like the first thing Bolsonaro, our last president, did once he, sat on his president chair, the first thing that he did was to take down all the websites that talked about HIV/AIDS and answered questions, for the population, the official websites, social media. Like they took down it's like they don't even want people to be informed regarding that, and that's an absurdity.
So a lot of still work to do. Clearly, we're not even with all of this new kind of technology and innovation, Magda, but it's not the best time because there are funding cuts, shifting priorities, as you said. Are we moving from even further away from emergency kind of HIV response to chronic disease management model? And with all of these funding cuts, what risks come with that transition?
Garry, it will be unfortunate if we go back. And now that we are closer than we have ever been to reduce HIV to a manageable public health problem, because it would mean we have lost years and years of investment, and we have kind of forgotten about the suffering and the death of millions of people. But and riding on the back of women being the face of this epidemic, at least when you look into not just the new the new infections, but people living with HIV/AIDS, majority are women, and in Africa, majority is women. It's not only about stigma; it's about all the other social norms and social determinants that perpetuate women in a position where they continue to be victims and continue to acquire infection because of their social condition, because of the poverty where they live in, and because of the lack of rights, lack of access, and the discrimination that women face. So it is important to note that we are living in times where gender equity is being rolled back. So it's not just stigma increasing, but we also have other issues that compound the HIV/AIDS problem. One such issue, important issue, is gender equality. So we need to work in different fronts for reducing the number of new infections. If we don't close the tap, despite the very promising technologies we have, we will not be able to finish the job. The funding cuts that are happening, at the same time, they are regrettable, but I believe they bring an opportunity for us to reshape the entire ecosystem where the HIV/AIDS response is provided. 80% of the funding for HIV/AIDS response used to come from outside the countries where the disease and the people are. It is important, if we talk about sustainability, that domestic investments, not only on HIV/AIDS, but the overall health system, be made primarily locally. And I should say that majority of countries, if you look closer into how the health systems are funded, the money comes from government, but it comes from out-of-pocket expenditures, people paying only when they are desperate and at the risk of becoming poorer than they are for health services that are generally unaffordable. So we need to rethink the model of healthcare prevention and provision that we have, balance the current financial crash with all that is going on around the world. It is unlikely that we will have much more money going forward than we had in the past. There are other issues to be tackled. There is climate change to be tackled. There is terrorism to be tackled. There are wars going on. There is malnutrition. We have a looming crisis when it comes to nutrition because of the climate change and the agricultural patterns and all that's going to be disrupted. We have increasing inequities. We have increasing poverty. So if we rethink development and not only integrate HIV/AIDS into the broader health system, but also look into how we approach development to see health at the center of development. Health at the same time, when you have healthy populations, your economic prospects for development are much better. And if your economy is going down, the first sector to feel it is the health sector. So we have an opportunity. The financial crisis brings an opportunity. It's up to us to decide whether we are going to tackle it and the best way of approaching it, or we are just going to sit down and wait until the crisis is over and then accommodate ourselves in our comfort zones and wait for external funding, traditionally from the donors we know, from the multilaterals, to fund health systems, or we are going to be innovative in the way we fund health systems.
So what I hear from you is that you look at this as an opportunity rather than
Absolutely.
A crisis, but obviously, and solidarity in the future has to start at country level, and the redistribution of that of the wealth and the the fragmentation, not only at the global level but also fragmentation country level needs to be fixed.
Fragmentation at all levels. We need to redistribute financing so that people stop being victims of out-of-pocket payments. We need to redistribute power so that women don't continue to be victims of men as they are right now. And we need to redistribute power between government and communities and civil society. We need to redistribute power between global media and local media, etc. Redistribute power between global north and global south. So there is a reset that we need to do. I'm not naive to think it's going to happen overnight. But if we change our mindset, if we commit to genuinely start by taking the steps that will fix some of the challenges that we are facing, and we can do that, the world will be a much better place for our children and our grandchildren.
Okay. So thank you for that, Magda. Now, I'm going to ask Marina to close us off by reading one of your poems that, in your view, best capture your experience and of someone who lives with HIV. And then you read that in Portuguese, please, and then you can share what it means in English briefly. How is that?
This is from my book, Exposta, which means exposed. Este vírus não tem cheiro, nem cara, nem cor. Sutil e pungentemente ele te ataca, normalmente, pelo coração. Pois quem você ama não sabe ou mente. Okay, so this is my little translation. This virus does not have a scent, neither a face or color. Very subtly, it attacks you normally through the heart because the person you love do not know or is lying.
Mm-hmm. Thank you for that, Marina, and thank you, Magda, for this really interesting conversation. I hope that this episode is going to add to increased and renewed focus on HIV around the conference that's coming up in July, end of this month. And Magda and Marina, hope I'll see you there.
Garry, I'm really grateful for this conversation on HIV/AIDS, which I think it's one of those have-to-dos that the global health system cannot ignore. Thank you for the opportunity. Thank you for bringing the issue to the fore. And we need to reunite. We need to re-engage to finish the job. Thank you.
Garry, thank you very much for inviting me to the podcast and the attention on this subject. And it's always great to have an ally. Obrigada, and see you soon.
I found today's conversation with Magda and Marina clarifying. 3 reflections stay with me. First, memory matters. The generation living and leading today often has no memory of HIV and AIDS and what it meant in 1980s and 90s. And without that connection to the past, hard-won lessons fade, stigma creeps back, and prevention falters. Carrying the story forward is part of how we end the epidemic. Second, we cannot treat the virus and ignore the person. HIV is never only a medical condition. It is bound up with mental health, stigma, gender, and dignity. As Marina reminded us, depression and isolation can be as dangerous as the virus itself. A people-centered response, one that sees the whole human being, is not a luxury. It is what makes treatment work. And finally, at this moment of funding cuts, it can be an opportunity. Magda challenged us to see the crisis as a chance to reshape how the HIV response is financed and to build solidarity that starts at the country level. I hope this episode leaves you with a renewed sense that ending HIV is still within reach if we have the courage to finish what we started. Before we finish, let's hear from one of our listeners.
Hello, my name is Francis, Dr. Francis Ohanido. I'm a public health physician. I'm the CEO of the West African Institute of Public Health, or the Director General, if you like. I listen to this podcast and I listen to it all the time. When I'm traveling, when I'm living, some of my downtime, I listen to it. One of the things I look at global health, I look at it from the point of future whispering. And when I listen to this podcast, I'm able to see new ideas or get new ideas about things that are happening by tracking the trends, monitoring what other people who are in the same space with me are doing. You know, global health matters. And for me, a key part of it is the fact that we can learn from each other. And one of the things this podcast does is start future whispering, giving you an idea of what is to come and what is already happening and some of the new innovations in the system. And I benefit from it a lot. I encourage you to go and listen to it and something else. Thank you very much.
Thanks so much, Francis, for your insights on how you think the podcast is helping you and how it really keeps you up to date with happenings in global health. Keep listening. To learn more about the topic discussed in this episode, visit the episode's webpage where you will find additional readings, show notes, and translations. Don't forget to get in touch with us via social media, email, or by sharing a voice message. And be sure to subscribe or follow us wherever you get your podcasts. Global Health Matters is produced by TDR, a United Nations co-sponsored research program based at the World Health Organization. Thank you for listening.